The Moore administration of Governor Sheriff Oborevwori said it is determined to develop a world-class health system in the state to address health challenges among Deltans. The Commissioner for Health, Dr. Joseph Onajime, made this position known in a 3-day health summit held in Asaba, Delta State. The health summit was organized by the Delta State government in collaboration with the World Bank. Dr. Onajime said the Health Ministry under the leadership of His Excellency Right Honorable Oborevwori has resolved to build a modern healthcare system that is available, accessible, affordable by Deltans. Added that without quality health service, all sectors of the economy are doomed.
It gives me great pleasure to welcome you to the 2023 Delta State Health Summit. The Health Summit being convened in mere 6 months into the administration of His Excellency the Governor, Right Honorable Sheriff Oborevwori, is a significant milestone and a stirring testament to the administration commitment to the Moore agenda. Following the just concluded Executive Council retreat, this summit could not have come at a more auspicious time, where strategic discourse and articulated in delivering the Moore agenda. I cherish the vision of the Moore agenda and of working hand in hand to improve the state we live in, especially in respect of our health system. It is for this reason that at the wake of taking on position as member of the State Executive Council and designated Commissioner for Health, I immediately embraced the idea of convening a State Health Summit.
The Commissioner noted that the goal of the Health Summit is to bring important role players of the health sector of the state to review where we stand and define informed decision on where we want to be and how we can get there.
It's a very good thing because this health summit Delta State is the first state that is organizing this summit to have a baseline and to assess the health facility and the human resource for health, to see how we can improve on all these indices and improve the health of our people.
He said the health summit is a direct extension of a rigorous health system assessment which allowed us to set a baseline for long-term health system, primary health care priority setting and planning for the state. Dr. Onajime commended the World Bank team in partnering with the Delta State government in areas of technicalities and financially to look into challenges of a quality health care system of the state. The lead facilitator of the World Bank team, Dr. Ashwin Bodin, said critical section of the summit is to validate findings of the health system performance assessment based on primary health care capacity scorecards.
We're here to do a health assessment at the behest of the government of Delta State, who came to us looking for an opportunity to provide a health summit. And we really thought, well, what should we do that on? And a health assessment, we thought, was the first step to really understand how is the health system performing, where are the weaknesses, where are the strengths, and we can use that, how can we use that as a basis for coming together to develop actions for the future of Delta State's health system.
Others who spoke in the occasion from the World Bank team were Dr. Manuela Urbe, Senior Health Specialist, World Bank, Dr. Onyorode Edire, Senior Health Specialist, World Bank, Abuja Office. They commended the state government for organizing the Health Summit, adding that the outcome gathered would be used to address challenges facing a quality healthcare system in Delta State and Nigeria at large.
For action in all of this meeting that we're going to have over the next 3 days. And thank you to everybody that's here, to our secretary, to As I said, great honor that you're here. It's a call for action for all of the work that we're going to be doing.
Then why is it important to have a roadmap, Delta State? It's still amazing that quite a number of women in Delta State still die because of pregnancy-related issues. And I see that no woman should die because of pregnancy. You should not die because you are giving birth to life. I'm sure you will agree with me. But that has been disturbed. That for every 1,000 women that deliver, more than 500 die because of pregnancy-related issues.
In a keynote presentation, Financing the Delta State Healthcare System, delivered by the Director General and Chief Executive Officer of the Delta State Healthcare Contributory Scheme, Dr. Isaac Akpovita, said the source of financing the state's healthcare system were taxation, health insurance, out-of-pocket, and donations. He said the Delta State government has continued to provide funding to run the healthcare system and would not relent while calling on partners to support the government, as government alone cannot do it all.
Financing comes from many sources. One of them is budgetary allocation, resulting from taxation. I'm sure you pay your tax. Part of the tax you pay is applied into health sector. Also, funding also comes from health insurance. When you buy health insurance, the premium you pay is part of the funding. It also comes from out of pocket. When you go to the chemist to buy drugs, the hospital, and pay with your own personal money, you are funding the health sector. And there are some donations that come from many Nigerians, philanthropic organizations, NGOs. All these put together form the pool of fund for funding health system.
Dr. Akpovita commended the organizers of the summit. The chairman of the Local Government Service Commission, Mr. Joseph Otaiwe, who was represented by the Director of Personnel Management, Mr. John Akwakwa, said the summit is a welcome development. He said the commission is faced of lack of manpower due to health workers leaving the country for greener pasture abroad, while appealing to stakeholders of the summit to come out with ways and findings in addressing these menace.